Vitamin B12 or folate deficiency anemia is a condition in which the body doesn't have enough of either vitamin B12 or folate, also known as vitamin B9, to produce sufficient healthy red blood cells. Both of these vitamins are essential for red blood cell production and the functioning of the nervous system. When there is a deficiency in either vitamin, it can lead to anemia and other associated health problems. Key points: vitamin B12 is primarily found in animal products, such as meat, dairy, and eggs. Folate vitamin B9 is found in leafy green vegetables, fruits, and fortified cereals. Anemia occurs when there is a lack of healthy red blood cells to carry adequate oxygen to the tissues of the body, causing fatigue and weakness. Causes of vitamin B12 or folate deficiency anemia. Vitamin B12 deficiency. Vitamin B12 deficiency can occur for several reasons, including poor diet. A diet lacking in animal products such as meat, fish, eggs, and dairy can lead to insufficient vitamin B12 intake. Malabsorption. Certain medical conditions, such as pernicious anemia, celiac disease, or Crohn's disease, can affect the body's ability to absorb B12 from food. Pernicious anemia occurs when the body produces antibodies against the intrinsic factor, the protein needed for vitamin B12 absorption. Gastric surgery. Surgery that removes part of the stomach, such as gastric bypass, can reduce the ability to absorb B12. Older age. The ability to absorb vitamin B12 decreases with age, which can lead to a deficiency. Medications. Some medications, like metformin used for diabetes and proton pump inhibitors used for acid reflux, can reduce B12 absorption over time. Folate deficiency. Folate deficiency can also result from a variety of causes. Inadequate dietary intake. A diet low in leafy vegetables, fruits, and fortified cereals can lead to folate deficiency. Malabsorption. Conditions like celiac disease or Crohn's disease can affect the body's ability to absorb folate. Pregnancy. Folate requirements increase during pregnancy, and a deficiency can occur if a woman does not consume enough folate-rich foods or supplements. Medications. Certain medications, such as methotrexate used in cancer treatment and autoimmune diseases, can interfere with folate metabolism. Chronic alcohol use. Excessive alcohol consumption can interfere with the absorption and storage of folate. Symptoms of vitamin B12 or folate deficiency anemia. Both B12 and folate deficiencies can cause similar symptoms due to the reduced production of red blood cells and the effect on the nervous system. These symptoms include fatigue, the most common symptom, caused by the body's inability to produce enough healthy red blood cells to carry oxygen. Paleness, a pale complexion, often seen with anemia. Shortness of breath. This happens when the body isn't getting enough oxygen due to a lack of red blood cells. Heart palpitations. As the body tries to compensate for the lack of oxygen, the heart may beat faster. Dizziness or lightheadedness, the feeling of being faint or dizzy, especially upon standing up. Weakness, muscle weakness or difficulty performing everyday tasks. Numbness or tingling, particularly in the hands or feet, due to nerve damage from vitamin B12 deficiency. Cognitive issues, memory problems, confusion, difficulty concentrating, or even depression. Glossitis, the sore, red, and swollen tongue that can occur in both B12 and folate deficiencies. Mouth ulcers. Painful sores in the mouth may appear with both deficiencies. In severe cases, B12 deficiency can cause neurological damage, leading to difficulty walking, balance problems, or even permanent nerve damage. Diagnosis. If a healthcare provider suspects vitamin B12 or folate deficiency anemia, they may recommend several diagnostic tests. Blood tests. These are used to measure levels of vitamin B12, folate, and red blood cells. Complete blood count (CBC). This test checks for signs of anemia and abnormal red blood cell shape or size. Vitamin B12 and folate levels. Specific blood tests are used to measure the levels of these vitamins. Methylmalonic acid (MA) and homocysteine tests. These tests can help confirm a vitamin B12 deficiency, as levels of these substances tend to rise when B12 is low. Intrinsic factor antibodies. In cases of pernicious anemia, testing for antibodies against the intrinsic factor can confirm the diagnosis. Treatment for vitamin B12 or folate deficiency anemia typically involves replenishing the missing vitamin and addressing the underlying cause. Vitamin B12 deficiency treatment. Oral B12 supplements. For mild deficiencies, vitamin B12 can be taken orally as a pill or sublingual under-the-tongue tablet. Vitamin B12 injections. In cases of severe deficiency or when malabsorption is a concern, B12 injections may be required to bypass the digestive system. These are typically given at regular intervals. Dietary changes. Eating more B12-rich foods, such as meat, fish, poultry, dairy, and fortified cereals, can help correct the deficiency. For vegetarians or vegans, fortified foods or B12 supplements are necessary. Treatment of underlying causes. If the deficiency is due to a condition like pernicious anemia or a digestive disorder, treating the underlying cause may also be necessary. Folate deficiency treatment. Oral folate supplements. Folate is commonly given as an oral supplement to correct the deficiency. The dosage and duration of treatment depend on the severity of the deficiency. Dietary changes. Increasing dietary intake of folate-rich foods, such as leafy greens, legumes, citrus fruits, and fortified grains, is recommended. Treatment of underlying causes. If medications or alcohol use are contributing to the deficiency, adjustments may be needed. In pregnant women, folate supplementation is often recommended to prevent deficiencies. Combining B12 and folate supplements. In some cases, healthcare providers may prescribe both vitamin B12 and folate supplements, especially if it's unclear which vitamin is deficient or if both are deficient. Prevention. To prevent vitamin B12 or folate deficiency anemia, consider the following. Balanced diet. Ensure a diet rich in fruits, vegetables, leafy greens, whole grains, meat, fish, dairy, and fortified foods. Vegans and vegetarians should pay particular attention to vitamin B12, as it is primarily found in animal products. Pregnant women should take prenatal vitamins containing folate to prevent neural tube defects in the baby. Supplements. If you're at risk for deficiencies due to dietary restrictions or medical conditions, talk to your healthcare provider about taking supplements. Regular monitoring. People with risk factors, such as those with gastrointestinal conditions or those taking certain medications, may need regular blood tests to monitor their vitamin levels. Complications. If left untreated, vitamin B12 or folate deficiency anemia can cause significant health problems, including neurological damage. In severe B12 deficiency, nerve damage can occur, leading to permanent problems with coordination, balance, and cognitive function. Heart problems. Anemia can put additional strain on the heart, leading to heart palpitations and other cardiovascular problems. Pregnancy complications. Folate deficiency during pregnancy can lead to birth defects, such as spina bifida. Conclusion. Vitamin B12 or folate deficiency anemia is treatable, and with appropriate dietary changes and supplementation, most people can recover fully. Early diagnosis and treatment are important to prevent complications, especially neurological issues that may arise from untreated B12 deficiency. If you experience symptoms of anemia, such as fatigue, weakness, or dizziness, it is important to seek medical advice for proper diagnosis and treatment.